a WikiVidi Documentaries production. Don't forget to like and subscribe. Enjoy.
Blood alcohol content. Blood alcohol content, also called blood alcohol concentration, blood ethanol concentration, or blood alcohol level, is most commonly used as a metric of alcohol intoxication for legal or medical purposes. Blood alcohol concentration is usually expressed as a percentage of ethanol in the blood in units of mass of alcohol per volume of blood or mass of alcohol per mass of blood, depending on the country. For instance, in North America a BrAC of 0.1 means that there is 0.10 grams of alcohol for every dl of blood. Estimated blood alcohol content by intake. To calculate estimated peak blood alcohol concentration, a variation, including drinking period in hours, of the Widmark formula was used. The formula is BrAC left times 10 where, regarding metabolism in the formula, females demonstrated a higher average rate of elimination than males. Female subjects on average had a higher percentage of body fat than males. Additionally, men are, on average, heavier than women, but it is not strictly accurate to say that the water content of a person alone is responsible for the dissolution of alcohol within the body, because alcohol does dissolve in fatty tissue as well. When it does, a certain amount of alcohol is temporarily taken out of the blood and briefly stored in the fat. For this reason, most calculations of alcohol to body mass simply use the weight of the individual, and not specifically his/her water content. Finally, it is speculated that the bubbles in sparkling wine may speed up alcohol intoxication by helping the alcohol to reach the bloodstream faster. Examples: BrAC 0.03253 for 483, approximately 0.033 grams per deciliter; BrAC 0.036495627, approximately 0.036 gram per deciliter. Note: this chart defines a drink as 14 grams of ethanol, while the formula defines a drink as 10 grams of ethanol. Standard drink sizes. Binge drinking. The National Institute on Alcohol Abuse and Alcoholism define the term binge drinking as a pattern of drinking that brings a person's blood alcohol concentration to 0.08 grams per cent or above. This typically happens when men consume 5 or more drinks, and when women consume 4 or more drinks, in about 2 hours. Units of measurement. There are several different units in use around the world for defining blood alcohol concentration. Each is defined as either a mass of alcohol per volume of blood, or a mass of alcohol per mass of blood. 1 milliliter of blood has a mass of approximately 1.06 grams. Because of this, units by volume are similar, but not identical to units by mass. In the US, the concentration unit 1% with V is in use. This is not to be confused with the amount of alcohol measured on the breath, as with a breathalyzer. The amount of alcohol measured on the breath is generally accepted as proportional to the amount of alcohol present in the blood at a rate of 1 to 2,100. Therefore, a breathalyzer measurement of 0.10 mg per liter of breath alcohol converts to 0.0001 times 2,100 grams, 10 deciliters, or 0.021 grams per deciliter of blood alcohol. While a variety of units is used throughout the world, many countries use the gram per liter unit, which does not create confusion as percentages do. Usual units are highlighted in the table below. Legal limits. For purposes of law enforcement, blood alcohol content is used to define intoxication and provides a rough measure of impairment, although the degree of impairment may vary among individuals with the same blood alcohol content. It can be measured objectively and is therefore legally useful and difficult to contest in court. Most countries disallow operation of motor vehicles and heavy machinery above prescribed levels of blood alcohol content. Operation of boats and aircraft are also regulated. The alcohol level at which a person is considered legally impaired varies by country. The list below gives limits by country. These are typically blood alcohol content limits for the operation of a vehicle. It is illegal to have any measurable alcohol in the blood while driving in these countries. Most jurisdictions have a tolerance slightly higher than 0 to account for false positives and naturally occurring alcohol in the body. Some of the following jurisdictions have a general prohibition of alcohol. Limits by country. BrAC, breath alcohol content. In certain countries, alcohol limits are determined by the breath alcohol content, not to be confused with blood alcohol content. Test assumption. Blood alcohol tests assume the individual being tested is average in various ways. For example, on average the ratio of blood alcohol content to breath alcohol content is 2,100 to 1. In other words, there are 2,100 parts of alcohol in the blood for every part in the breath. However, the actual ratio in any given individual can vary from 1,300 to 1 to 3,100 to 1. Or even more widely. This ratio varies not only from person to person, but within one person, from moment to moment. Thus a person with a true blood alcohol level of 0.08%, but a partition ratio of 1,700 to 1, at the time of testing would have a 0.10 reading on a breathalyzer calibrated for the average 2,100 to 1 ratio. Metabolism and excretion. Alcohol is absorbed throughout the gastrointestinal tract, but more slowly in the stomach than in the smaller large intestine. For this reason, alcohol consumed with food is absorbed more slowly, because it spends a longer time in the stomach. Furthermore, alcohol dehydrogenase is present in the stomach lining. After absorption, the alcohol passes to the liver through the hepatic portal vein, where it undergoes a first pass of metabolism before entering the general bloodstream. Alcohol is removed from the bloodstream by a combination of metabolism, excretion, and evaporation. Alcohol is metabolized mainly by the group of 6 enzymes collectively called alcohol dehydrogenase. These convert the ethanol into acetaldehyde. The enzyme acetaldehyde dehydrogenase then converts the acetaldehyde into non-toxic acetic acid. Many physiologically active materials are removed from the bloodstream at a rate proportional to the current concentration, so that they exhibit exponential decay, with a characteristic half-life. This is not true for alcohol, however. Typical doses of alcohol actually saturate the enzyme's capacity, so that alcohol is removed from the bloodstream at an approximately constant rate. This rate varies considerably between individuals. Another sex-based difference is in the elimination of alcohol. People under 25, women or with liver disease may process alcohol more slowly. False high readings are related to patients with proteinuria and hematuria, due to kidney-liver metabolism and failure. Such persons have impaired acetaldehyde dehydrogenase, which causes acetaldehyde levels to peak higher, producing more severe hangovers and other effects such as flushing and tachycardia. Conversely, members of certain ethnicities that traditionally did not use alcoholic beverages have lower levels of alcohol dehydrogenases and thus sober up very slowly, but reach lower aldehyde concentrations and have milder hangovers. Rate of detoxification of alcohol can also be slowed by certain drugs which interfere with the action of alcohol dehydrogenases, notably aspirin, furfural, fumes of certain solvents, many heavy metals, and some pyrazole compounds, also suspected of having this effect, are cimetidine, ranitidine, and acetaminophen. Currently, the only known substance that can increase the rate of metabolism of alcohol is fructose. The effect can vary significantly from person to person, but a 100 grams dose of fructose has been shown to increase alcohol metabolism by an average of 80%. Fructose also increases false positives of high BrAC ratio readings in anyone with proteinuria and hematuria, due to kidney-liver metabolism. Full stomachs. Alcohol absorption can be slowed by ingesting alcohol on a full stomach. The belief that the food absorbs the alcohol is a common misconception. Alcohol absorption is slowed because the stomach sphincter closes in order to break down the food. The alcohol cannot be absorbed through the stomach, thus cannot be absorbed until the sphincter is opened and the consumed alcohol can flow to the small intestine. Retrograde extrapolation. Retrograde extrapolation is the mathematical process by which someone's blood alcohol concentration at the time of driving is estimated by projecting backwards from a later chemical test. This involves estimating the absorption and elimination of alcohol in the interim between driving and testing. The rate of elimination in the average person is commonly estimated at 0.015 to 0.020 grams per deciliter per hour, although again this can vary from person to person, and in a given person from one moment to another. Metabolism can be affected by numerous factors, including such things as body temperature, the type of alcoholic beverage consumed, and the amount and type of food consumed. In an increasing number of states, laws have been enacted to facilitate this speculative task. The blood alcohol content at the time of driving is legally presumed to be the same as when later tested. There are usually time limits put on this presumption, commonly 2 or 3 hours, and the defendant is permitted to offer evidence to rebut this presumption. Forward extrapolation can also be attempted if the amount of alcohol consumed is known, along with such variables as the weight and sex of the subject and period and rate of consumption. The blood alcohol level can be estimated by extrapolating forward. Although subject to the same infirmities as retrograde extrapolation, guessing based upon averages and unknown variables, this can be relevant in estimating back when driving and or corroborating or contradicting the results of a later chemical test.
Brought to you by WikiVidi Documentaries. Would you like to know more?